My name is Debe. I'm in the Northwest Florida State College BSN program, and I'm going to do a presentation on antibiotic resistance. I chose my PICO question on antibiotic resistance and the topic because I work in the ER, and a lot of people come through there with viral infections and other things going on that do not need antibiotic care and are persistent about getting antibiotic prescriptions for things that are not needed, which leads to our problem of antibiotic resistance. There were 3 articles that I chose. I chose them because one of them was the only result that I got when I searched for antibiotic resistance. The second one was more on a physician's point of view about the subject and how they learned from the pamphlets that were handed out. So I just wanted one article on the physicians. And then the third article was based on the parents' and families' perceptions of antibiotic resistance and antibiotic prescribing. So I wanted to get all areas covered with my 3 articles. The one that was the only search result that I received was an article on the CRP testing. The results of that article was really wonderful. It showed that just by doing one blood test, the docs could verify whether that patient had a viral infection or bacterial infection and know whether to prescribe antibiotics just based on that one blood test. The second article resulted in physicians being reminded of antibiotic resistance and overprescribing and decreased the prescribing amount by 19%, which is wonderful. The third article on the patient or the families in the community and the parents showed that education about antibiotic resistance is actually on the rise, which means antibiotic resistance is on the decline. And it really is a good article to show nurses that, education goes a long way. How I can use all this in my practice in the ER, like I said, we have a lot of people that come in and request antibiotics for things that don't need it. So all these articles together, I learned about the CRP testing. I had no idea that you could do that test for viral or bacterial infections. So I can pass that along to the doctors and request that before they prescribe antibiotics. The second article, I can use the parents' article by knowing that a little bit of education goes a long way. So when parents come in requesting antibiotics for their children, I can educate them on viral infections not needing antibiotics and bacterial infections working with antibiotics, And then the third article on the physicians, just reminding them and encouraging them not to overprescribe antibiotics is a really good practice. So I pulled something off from all 3 of these articles that should benefit me in my career. And then, of course, I have my references down there, but I'll give you a close-up of the slides on my billboard. There's my antibiotic resistance. I just have this sign with Batman and Robin. I think I need antibiotics for my cold, and Batman slapping him saying it's a virus. I just did a little, what is antibiotic resistance? My PICO question. My search and sources. Chart. My critical appraisal. My introduction to clinical practice. And my references. And that completes my presentation. Thank you.